Hi, in this video, I'll be talking about the fact that your breast cancer diagnosis does not define you as a person and how to navigate some of the things that come up when you think about your own identity. First, I'd love to invite you to subscribe to our channel. We put out 3 videos a week, so there's always new content. So when you're diagnosed with breast cancer, or really any serious illness, a lot of times the disease will come before you. So what I mean by that is you'll hear yourself described as a breast cancer patient, which puts the breast cancer ahead of the person. You are somebody who has breast cancer. You are so many other things. When you interact with your medical team, you're often in a gown. You're told where to be when. You have very little autonomy in terms of what you do with your time, and certainly a breast cancer diagnosis, the process of being diagnosed, and then everything that happens afterwards can take a lot of time and energy and thought and creativity just to make it fit in. So it's understandable that people would consider themselves a breast cancer patient. I'm here to remind you today that you are so many other things. So when you're first diagnosed, it's normal that you would have a host of emotions. When we talk about emotions, we're talking about things we feel in our body that are often triggered by our thoughts or the stories we tell ourselves. You may be shocked and stunned that you were diagnosed with cancer. You've done everything right, or even if you've made some mistakes in your life, there's really nothing that explains a breast cancer diagnosis in a given person. We know risk factors, but most of our patients have no risk factors for breast cancer. This means that most people are shocked and surprised when they're diagnosed with breast cancer. Now, for some people, it can be a relief if they've had symptoms like a lump or itching or redness and they're finally listened to and finally diagnosed. But most breast cancers are diagnosed when people have a screening mammogram, for example, and you go in for what is meant to be a routine mammogram, and then you're told that additional pictures need to be taken that leads to a biopsy, et cetera, et cetera. So this separation from your former life can happen very suddenly, which can lead to shock and disbelief. And it can take a long time before the fact that this is actually your diagnosis sinks in for you. The other thing you may feel is anger and frustration, not just for the diagnosis, but for all the other things that have to fall into place after that, and all the indignities that happen as part of being a patient, part of being told where to go, the gowns that make you look like everybody else, and all the other things your body's put through, the pokes and the prodding and all the exams and answering the same questions over and over again can make you feel really frustrated. It's completely understandable. You may also have grief, sadness for the life you had the day before you were diagnosed. And you may also have anxiety, wondering what's going to happen to you, not just today or tomorrow, but down the road into the future. Even people with an excellent prognosis are really brought up short with their mortality because we use words like, we are going to help improve your survival, or the odds of survival. So just the fact that we're talking about survival means the dark side of not surviving is introduced into your thoughts. So it's natural that being diagnosed comes with a whole tsunami, if you will, of emotions. And this can really sweep you up, as well as those people around you in your circle, whether they're at work, at home, in your community, in your extended family, or in your chosen family. So it's really important to understand these feelings are normal. There are really no wrong feelings, and to acknowledge what you're going through. My wish for you is that you can have these feelings and validate them for yourself, as well as find people who will validate and normalize those for you. So you have this wave of emotions. You have a before breast cancer and an after breast cancer. How do you give recognition and honor to all the other parts of you that are more than just your cancer and your cancer diagnosis? Sometimes in medicine we'll say such and such is a 54-year-old postmenopausal woman with a stage 2 ER positive, HER2 negative cancer, and you get reduced to those lines. in the opening sentence of the section of our chart called History of Present Illness. And I wouldn't be surprised if some of you are looking at that note in your records and saying, and I'm so much more than that. I'm a mother, I'm a daughter, I'm a sister, I'm a husband, I'm a brother. I'm all these other things. I have a career, I'm a volunteer, I'm an artist, all these other parts of you that aren't included in that first line of your doctor's notes in the History of Present Illness. My wish for you is that you would recognize and honor all those parts of you. And although it can be really hard in the whirlwind of an early diagnosis as your treatment plans are being laid out, and frankly, during treatment itself, even if you just have to name all those things, keep a journal and write down all those different identities. Walt Whitman, the poet, said, I contain multitudes. And I'd like to appropriate that and say, you contain multitudes. You are so many more things than your diagnosis. So how can you give attention to those? Well, in addition to naming all those other parts of yourself, you can plan. You can think, one of the things I'd like to do when things settle down, because I promise they will settle down, is I'd like to go back to my painting or my writing. I have always been a volunteer. In the last few years, I've been so busy with COVID, I haven't been volunteering, and that's a part of me I want to honor. I'd love to invite you to think about your values and what's truly important to you. Yes, you're showing up at your appointments and you're sticking your arm out and getting your treatments, changing into the gown for your radiation therapy and asking all the questions we encourage you to ask here at Yerbba. You might be going to yerbba.com to get your personalized report, as we always encourage you to do on our videos. But there's so many other things, and thinking about those and saying an intention that you are those things and that you will return to those things again when things settle down. Let's say you're a couple of years out from the end of your treatment and you feel still like a breast cancer patient. Now, for some people, I have to say that this identity can be very helpful to them. And there are people who wear the pink ribbons and the pink clothes, and this becomes part of their identity, and that they find this gives them a sense of belonging to a community. I never want to minimize your community of other people who've been through this. But you have these other parts, and identifying what's important to you. Getting through treatment and being there for your family or getting back to work are important. What other things are important to you? Is honesty important to you? What are ways that you live out being an honest person? Is generosity important to you? Is trust important to you? How can you bring more of those things into your life and into your identities, in addition to somebody undergoing breast cancer treatment or who is a breast cancer survivor? You may not even be comfortable with the word survivor. You may have other words, or you may feel, if you're not sure how things are going to go down the road, do you get to call yourself a survivor? I would love to tell you that we define survivor as somebody who, from the day of diagnosis till the day they die of breast cancer, or more likely something else. You are a survivor. Frankly, we're all survivors of something, right? We're survivors of a difficult childhood or other illnesses. We all survived the pandemic. We know people who didn't. So all of us are survivors, and you can claim that identity if it's important to you. And in addition, give nurturing and foster your other identities as well. And if survivor is an identity that appeals to you, or having been through breast cancer appeals to you, obviously it would make sense to honor your strength and resilience. You can write declarative sentence. I am strong. I am resilient. Or sometimes I am strong. Or I have had to be strong. What other choice do I have? Identify your strengths. So we've talked about your values and your interests and all the other identities you've had before, maybe even when you were much younger in life. But I'd also love you to look at your strengths. And if you're not sure what they are, you can ask the people around you, what are 2 or 3 things you really like about me? And hearing back your strengths reflected to you from others who care for you or people who work with you can be incredibly helpful in looking at all the different parts of who you are. I hope this has been helpful. I've covered a lot, Don't forget to subscribe to our channel and to go to yerbba.com to get your personalized report. You can drop a comment or question below. Although we can't give medical advice, we would love to hear from you, hear about your experiences, and we can answer questions in a general way if you drop them below. Thanks for watching.